This is a message that I want spine physicians to think about. This is specifically directed to orthopedic spine surgeons, neurospine surgeons, and other spine specialists. Recognize the fact that all spine problems, with the exception of cancer and trauma, start because of a torn disc, the torn annulus fibrosus. That small layer, there's 17 of them, but it starts with that small tear, and that leads towards disc protrusion, disc herniation, disc degeneration. And then when a disc is compromised in its integrity, each disc is adjacent to two facet joints, and so those two facet joints will be slightly misaligned compared to a normal segment. And that'll lead towards facet hypertrophy, facet arthritis. And this is leading people down pathways of the spine mill, epidural injections done ad nauseum with corticosteroids that damage people, with rhizotomies or neurotomies. They cut the nerves. They lead towards denervation, muscle atrophy, yet they're still being done for, and they're being paid for by insurance, knowing that both of those damage the spine long term. But they're doing that. Every pathology, again, begins with the annulus fibrosus tear. And so for that reason, it makes sense to identify that annulus fibrosus tear early and treat that tear specifically with the fibrin, because the fibrin is the only biologic that stays in the tear because of its bioadhesive properties and has the ability to regrow the tissue to cause that tear to heal. Nothing else has done that before. And think about that. The Discseel procedure just makes sense because it treats the origin of every spinal pathology that exists in the world.